As a practicing veterinarian, you may think you see lots of different kinds of exams through the course of the day. Exams about skin, allergies, arthritis, puppy vaccines. But the reality is there's only two kinds of communication that take place in the veterinary setting. There are wellness exams and there are problem exams. Obviously, in wellness exams, we're talking about routine vaccinations, worming, and other preventative treatments. But problem exams really are a form of crisis management, and crisis management means risk communication. When there's a client that's concerned about something that's happening or could happen, that is risk communication. And at that point, we have to shift gears. Our options here when we're confronted with that issue are to talk about statistics. So we might, for example, if the question is about the safety of anesthesia, we could quote statistics to the client. And while those statistics may be completely valid, the reality is that if your animal is the one out of 100 that ends up having the bad thing happen, you don't really care that it went well for the other 99. We can discuss our professional experience about the procedure that's in question. The problem with discussing professional experience is that this can imply a guarantee of success. And if things don't go as planned, you could be in trouble. Really, acknowledging and discussing risk is the most ideal way of addressing this. It gives clients an opportunity not only to hear that you understand the risk, the tangible reality, and for you to get informed consent from them on it, but it provides a level of reassurance that you're on the job because you can talk with them about how you're going to minimize the potential risk that's out there. When clients have accepted your proposed treatment plan after you'd advise them about the risk, then they are as informed as possible. And by letting them decide, you have kept them in the driver's seat because ultimately they made the decision to act or not to act, and this reduces your liability. Peter Sandman, who's written on risk communication for more than 40 years, found that people readily accept risk with less fear and outrage based on a variety of factors. The factors on the left have a lower level of outrage, fear, and dread versus the factors on the right. So if we take, for example, a dog that has an upset stomach, if this was voluntary, the dog raided the trash can, or the owner gave the dog some table scraps, that owner is going to be much less outraged, fearful, or full of dread than if it was involuntary. For example, the dog was poisoned by the neighbor. This is important when we are dealing with emotionally charged situations. Let's say the client who has assumed that the dog was poisoned by the neighbor, even though you think that the dog probably got into the trash or got some table scraps. If you dismiss that client with a high level of outrage and simply say, I think your dog just got too much food, you're going to shut them down and they are going to walk out of your door unhappy. But if you recognize their high level of outrage and help them address it, why don't we do some lab work and just make sure your dog isn't poisoned? And if it isn't, then we'll have to figure out what else happened. You will have validated their concerns. At the same time, you can then communicate with them and help them understand what really happened. Personally controlled versus controlled by others. Let's say a dog started a fight and was bitten versus the dog that was attacked while on a walk. Those of us in private practice have certainly seen this, and the level of anger, outrage, fear, or dread is much different when the dog bit another dog versus when that dog was bitten or attacked. A familiar versus exotic, an ear infection, familiar, probably not such a big deal as far as the client's going to be concerned. Exotic, hemolytic anemia. Just the words themselves are scary. So trying to explain how the immune system is attacking the animal, you're going to have a client who's very fearful. Understanding this helps you to communicate things in a more patient and effective manner. Reversible versus permanent. Permanent diabetes, classic case. One of the most difficult things any practitioner has to do when they've newly diagnosed an animal with diabetes is convince the owner it's not going to be that big of a deal. Reversible, an abscess. We lance this, we drain this, everything's going to be okay. And the natural versus man-made. Doug ate a plant in the backyard and got an upset stomach. There's going to be a certain level of anger about that, outrage. But if that pet got an upset stomach because they ate tainted food, then that is really going to make that client unhappy. So as we try and work through our client communication scenarios, it's so important to try and figure out where they are on this risk communication gradient. Are they more to the left? Or are they more to the right? Understanding this will help you communicate with them more effectively. And if you've communicated with them more effectively, you will have reduced your liability. Thank you.